Welcome to another episode of Office Hours with State Representative John Hampton. I am Representative John Hampton, representing the 16th District, which is Simsbury. And my guest today is leading the charge in Connecticut of protecting our most vulnerable population, our aging population, which is going to be exploding in the next 10 to 20 years. And this friend of mine, this colleague, is an amazing woman. She has taken over as the commissioner of the aging department in the last 6 months. Her name is Betsy Ritter, and I'm so delighted to welcome her to my program.
Thank you, John.
Commissioner, welcome. It's great to see you.
It's a pleasure to see you.
Representative Betsy, I had the pleasure of knowing you when I was a freshman legislator, and I have fond memories of being, of course, overwhelmed, but having folks like you who were so good to freshman legislators and nurturing and supportive as we jumped into the fray, and supportive of my water legislation and other things that I worked on. So I wanted to thank you. And then, of course, I was so disappointed the minute I get here, you move on, but you moved on to a really exciting position. And as a longtime advocate of elderly and a member of the Aging Committee, I was thrilled to have you fill that important position. So I wanted to welcome you and ask you to tell us a little bit about your background first, and then we'll talk more about your work.
Sure.
In the
First,
department.
I want to say that I was equally pleased to have the opportunity to work with you and watch you as a legislator really just jump right into the legislative life and to take on issues that lots of us had realized were out there and were important for a long time. The water is a perfect example, but were big issues, very big issues, critical to your district, but important to the whole state.
Absolutely.
And
Absolutely.
at the time, I was representing what I called a downstream district down on the shoreline, and
Waterford
and Montville.
Okay.
And indeed, those are issues that really the state owes a thank you to you for taking on and continuing to pursue.
Thank you. How long were you a legislator?
I served as a state representative for 10 years.
Okay. And before then?
Before that, I worked in my municipality in a variety of elected jobs, the most recent being serving 7 years as its full-time elected tax collector. As a job that...
Very popular.
Yes, very popular. Ever popular job. I often tell people that it sort of thickens your skin up a little bit if you're interested in continuing to work with the public. The truth was, I loved that job, and I really enjoyed the opportunity to work for my town in that capacity.
You were the second commissioner.
Correct.
In a second iteration.
Correct.
So tell.
Sure.
It had existed 20 years ago?
Oh, yes. Until about 1991, for decades, Connecticut had a Department on Aging. You might remember that 50 years ago, when the federal government passed the Older Americans Act, they set up a system for allocation of the federal funding that came through that Older Americans Act to designated state units on aging. And Connecticut's then State Department on Aging was the designated unit. In about 1991, then Governor Ritter took the State Department on Aging and several other smaller agencies and rolled them into the Department of Social Services in an effort to streamline government, effectively making a large agency larger. And only in 2013 did the State Department on Aging become reestablished along with the State Department of Housing and the State Department of Rehabilitative Services, and I think one other, I can't remember, and become reestablished as independent agencies.
And that was with Edith Prague?
Correct.
God
The interesting thing is that back in 1991, Edith Prague was commissioner of the State Department on Aging. And after the agency was absorbed and the Department of Social Services, she went on and served many, many years, as we know, in the state Senate.
Sure.
When the State Department on Aging was reestablished by Governor Malloy, he reappointed her as commissioner.
Yep.
And she served about a year and a half before she retired.
And you stepped in January.
I did.
Okay. How has it been?
It's been a lot
Roller coaster?
a roller coaster, a lot of fun, a lot of learning, and a lot of time to understand that Connecticut is very well served by an agency with experienced and dedicated professional state employees. These people really understand their jobs and work hard on behalf of the aging population in Connecticut. We're well served.
And we need to be well served because how many currently seniors do we have in Connecticut? And as I said earlier in the introduction, there will be an explosion
That
in
is
the next
correct.
10, 20 years. Currently, what are our statistics for?
Currently, we have about 731,000 people in Connecticut age 60 and over.
Okay.
And that is the target population for the State Department on Aging,
Okay.
the defined population. Right now, that means that Connecticut is approximately seventh, I believe, in the country in terms of the proportion of its population that is over that age. We
Wow.
are soon to become sixth. It also points out that in Connecticut, we have one of the highest average ages of the population in the country. And so, yes, it is a very rapidly growing sector of our population because of people like me, baby boomers.
The boomers.
That's right.
Now, what will those numbers look like in the next 10, 20 years? Then?
In the next 10 or 20 years, Connecticut should move well above 20% of its population.
Wow.
And I should remember the number. By 2030, I think we're going to be approaching closer to about 25%. So it's a large group. And interestingly enough, the demographics and the looks at the portion that's moving into the over 60 range is very interesting because people have different anticipated needs.
Sure.
And probably are going to want to see things done a little differently.
Is the state and the nation as prepared as it should be?
Oh boy, that is a question that certainly concerns me.
Absolutely.
And concerns all of us at
policymakers.
aging as policymakers. One of the biggest issues that I believe we're going to be facing is our need for people to serve as caregivers to this
Absolutely.
population. And I should back up a little bit. The mission of the State Department on Aging is to empower our older adults to live independent and secure lives and to have the security and knowledge for the future to make their own decisions about how they want to live. And that's a big one because it also carries with it a sort of a corollary that when it's needed, we need to be prepared to deliver the care, if necessary, the institutions and places for people to live securely and safely as they need to, as may be their choice. As people increasingly choose to remain in their homes, and speaking for myself, I can tell you it's what I certainly hope and
Sure.
intend to do.
Most people
We will
do.
need caregivers and help in order to do that. It's in the best interests of the state that we do that. It's also in our own personal best interest because people generally are happier when they're able to make those decisions on their own. And that's going to put a big demand out for caregivers, for caregiving as a profession to be one that is sustainable for people to engage in and enable more and more people to become interested in being caregivers so that we can all prosper.
You know, you make a good point because I don't think we do have that interest, enough of an interest in that. And I think maybe that's part of our culture or this time in our history. You know, I have friends who had family members, they had 3 generations. It was customary to have grandma living with you and grandpa and Uncle Joe, and that was part of our kind of background. But now it seems, I don't know if it's kind of the American glamour, sexy, and youth, that this is not by any means this is a scary topic, and I think people maybe shy away from it. And I'm amazed by people of my generation, I'm a caregiver of my 6 siblings, my parents, how unprepared we were. There is no manual, if you will, and it is a complicated system. There's the emotional aspect of it, the legal aspect of it. Where do you go from here? That
That
all
is
of a sudden
correct.
you are in charge.
All of a sudden, you're in charge.
And if I'm having trouble as a state representative and somebody who comes from resources and good background, there's people who are poor, cultural, ethnic disparities who might not have the tools or resources to programs and services that are out there.
That's
So,
right, and that adds layers and layers of complexity onto the issue. And for many cases, what is already a difficult emotional transition
Absolutely.
as we move from being the children to being the parents,
Yep.
perhaps. And the same will occur perhaps for me and my spouse or my spouse. One of us will be caring for the other in a different way.
Well, you and I aren't getting older, right?
Of course, I didn't mean to imply that.
I love when I go to speak to groups and they always say, Representative Hampton, it's great that you do that work for the elderly, and they kind of say it condescendingly, and I say to them, it's not a special interest group. It's not a rare disease
It's
that
us.
just affects a segment. It happens to all of us,
That
Lord
is
willing,
correct.
that we live long and prosperous lives.
That we
So-
have that blessing and that
Correct.
opportunity. That is correct. But along with that comes, I think, an increasing responsibility on all of us to understand and work towards the provision of safe and secure and reliable networks to help us care for each other as we age. And
Now,
it's a challenge.
you were a frequent presence at the Aging Committee, of which I sit on that for 2 terms now. It's a great committee, and you were often there. And if you want to talk about some of the legislative successes we had this year, in particular the CARE Act and other legislative victories, if you want to talk a little bit about that, that'd be great.
Certainly. Really, the big one this year, as you've already indicated, was what's called the CARE Act. And essentially, that provides that when someone is discharged from a hospital, they have already had a designated responsible party for their health, for their medical instructions, for essentially their immediate welfare in their what I will refer to as their post-recovery time. And the reason that was important, it was important really to a lot of different groups for a lot of different reasons. Most immediately to the patients and their families. Often there was lots of testimony and information to the point that sometimes family members would have a member discharged in their, quote, care quickly. They hadn't had time to prepare perhaps everything at home that needed to be ready. Perhaps they didn't know or understand the necessary care plan that they are now responsible for seeing administered to their loved one, to their family member. Sometimes there wasn't a family member available because of the particular circumstances of the patient, yet the patient was going home. And those were concerns also for hospitals, because when that would happen, there's a much greater chance that patient would be returning to the hospital.
Yeah.
Something didn't go right, and a whole host of sort of issues around that.
Yeah, and I can speak to that personally. When my mom went home from the hospital, a few food needed to be pureed. So, okay, we had to buy a puree machine
Yeah.
and a thickener for food,
Uh-huh.
and of course the jerry chairs and
Maybe you weren't ready for that.
Correct. Life alert systems.
Yep.
Moving carpets, so there's less fall risk. So that was huge.
There's a lot of interesting sort of related topics come up along with that. You talked about fall risk. One of the things that at the State Department on Aging we're pleased to be able to do is to coordinate fall prevention programs and their delivery around the state. Just looking at fall risk is amazingly effective in terms of reducing falls the costs, the pain, the suffering to the patient and to the family members, but also to increasing the general health and welfare around the home. And that's something that, as simple as that, has been amazingly effective in the aging network, and just helping people return to home safely. It's an interesting one, and if someone, perhaps you weren't prepared for that initially when your mom came home, it takes a little work.
It does.
And some understanding about what you have to do. So I think it's a really smart thing for the state of Connecticut to have so enthusiastically supported this CARE Act. I can tell you from my position advocating for it as a commissioner, it was a pleasure to understand that the hospitals, most particularly, were very, very supportive. And that's great because a lot of the burden came on them and they gladly took it up.
Sure. Now, what are your top priorities moving forward? You must go home and your head spins, working hard with, you're one of the smallest, you are the smallest
We are,
agency.
yes, small but mighty.
Yeah, small but mighty.
And rapidly growing, don't forget that.
Yes, and by the way, you have the Ombudsman Office underneath you.
Yes, that is right. The
Nancy
long-term
Schaefer.
care
Yeah,
ombudsman
she's great.
is part of the State Department on Aging.
Yeah, a lot of people don't know about her role and that person's role.
Correct. What the long-term care ombudsman its position is responsible for ensuring that the rights and welfare of the residents of our long-term care facilities, and that's nursing homes, assisted livings, residential care homes, are protected and that they are properly represented. And that often is through the families of those residents too. So they work with the residents and they work with their families as well.
I was so excited to meet with her and to learn more about that position, not just as a legislator, but as a person with someone in a nursing home, just to learn that, that's an important role.
It is.
That people have that protection and their rights are protected.
Correct. And another thing that's very interesting is an understanding of the dynamic between the Office of the Long-Term Care Ombudsman and the nursing homes, the care homes or the assisted living. And while they are firmly on the side of the resident, they do a lot of work on behalf of the administration and management of those facilities in helping the residents and their families understand what to expect while their loved one or while they are a resident in the facility. So it works both ways.
Who else falls under your jurisdiction? You've got the ombudsman, you've got who else?
The most popular and most, or at least the most widely acknowledged programs that we run are the provision of meals for both homebound and congregate meal recipients all over the state.
Meals on Wheels.
Meals on Wheels, known as Meals on Wheels. What happens is the Federal Older Americans Act, when it was first enacted, set up a system for states to ensure that this support was available across the state. So Connecticut, like every other state, has designated area agencies on aging.
Yep.
We have 5 in Connecticut, and they cover the entire state. And we funnel Federal Older Americans Act funding through those area agencies on aging for the provision of services. And the big service that many people know about is the meals service. So meals are provided in homes to people that need them there, but also to congregate settings. I think it's about 225 all across the state. We served over 2 million meals in 2014, which is a lot of cooking.
It's amazing. And do folks go through then their local Simsbury Social Services to access that?
And or senior center or municipal agent.
Okay.
So you probably know that Simsbury, like every other town in Connecticut, is required to have a designated municipal agent. Mm-hmm. They may have a senior center with a senior center director, and sometimes that's the same person as the municipal agent. It depends on the town, how the town chooses to do that, and or a separate social services department or representative. And that's the point for the delivery specifically to the town of Simsbury of a lot of these services.
Yeah, we're lucky to have a director of social services and
You
a
are.
senior center
How fortunate.
director.
And I can tell you that those people will increasingly, as your population also changes a little bit and you have more people in need of services associated with the elderly or people with disabilities, they will become busier and busier in the coming years.
Well, in so many areas. I mean, housing for seniors concerns me, affordable housing, transportation, employment. The good news is people are living longer, as you know. The scary thing is that, as I said earlier, I don't think we're as prepared as we should be. So for jobs, for example, the job market is tough enough with younger people, middle-aged people. But I have people in my district who are in their 60s, vital, early 60s, mid-60s. They say, I don't want to retire.
Right.
I want to work. I want a second career.
That is right.
So
that is correct.
There's a challenge, too, that
is
we're facing. It's good news,
absolutely
bad news.
Correct. Good news and bad news. That's
Yeah.
right. You talked a little bit also about the disability community. So the Federal Older Americans Act sets up, it's federally administered through Health and Human Services. And the Administration for Community Living is the unit inside the Federal Health and Human Services. And a big initiative that started in 2006 was the creation of what we call ADRCs, which is Aging and Disability Resource Centers.
Yep.
Each of the Connecticut's 5 area agencies on aging has an ADRC. So it's not just seniors that can receive services there, but also folks with disabilities concerned about the Medicare program, their choices about insurance. Perhaps they receive both Medicare and Medicaid. They want to know how those things work together. Maybe they're interested in some of the chronic disease or self-management program information that can help them. Perhaps it's issues around fall prevention or a respite because they're either the caregiver for a family member, maybe has Alzheimer's or requires another form of help, and they could benefit from some of the state's respite care programs. All of those, the contact point then would be the Area Agency on Aging.
So Simsbury
ADRC.
has its own. Simsbury is part of which area? Do you know?
North Central
North
Area
Central.
Agency
Okay.
on Aging, based in Hartford.
Perfect.
And it's a wonderful network because that foundation that was created 50 years ago by the Older Americans Act really is the sort of the guts of the aging and disability network, service network around the state. And that's been something that over the years has proven to be adaptable as people's needs and requests have changed, but also a constant, providing access to information about all those programs. I'll give you an easy example. Medicare. I myself am 64. I'll be 65 next year. Before I turn 65, I have the opportunity to learn a lot about the choices that I will have when I turn 65 or I choose to go on Medicare, and the choices that can make the biggest benefit, can provide the best benefit for me personally because of my health care, because of my anticipated needs, because of my family situation, whatever. The area agencies on aging provide the program we call Choices in Connecticut, and it's delivered through your senior centers. Your Simsbury Senior Center will know how to put anybody in that position in touch with a Choices counselor, either a volunteer or the Choices coordinator for your district, and get that information to them. There are decisions that you make at that time that can make a difference and to anybody. And it's important they understand all of them.
Great. I'm not sure a lot of people realize that. They can go to.
It's easy. I think that we talked about making sure that the telephone numbers and all are available, and I think we could put them up when we're finished. And important that people all over the state understand not to hesitate to give them a call and ask a question. I'm approaching Medicare age. I have a question about long-term care planning. When should I start doing it? Can you help me understand my options? There's just a wealth of information there for people, and I really encourage you and anybody interested to take advantage of it.
Yeah, we'll display your information, your website,
Thank
your
you.
phone numbers. No, thank you, because it's important to me as a legislator, because as you know, as a former legislator, so often you get called from folks looking for resources. Where do I go from here, so to speak? And,
Exactly.
And knowing about these resources, which is great, is so important. Now, what will be the Betsy Ritter stamp on the on this department that you really want to see happen in the next year or two? That you want to? What's your main mission?
I can tell you that we've talked about many of my concerns.
Yeah.
A couple of ones that are sort of rising to the top now. One has to do with the area of elder justice, elder abuse, and financial exploitation, increasingly more and more in the news.
Absolutely.
Governor Malloy very wisely established Connecticut's Coalition for Elder Justice by executive order, and in, I believe it was 2013. And that has grown by leaps and bounds. It's a public-private coalition in the state of Connecticut. We're a little ahead of a lot of states in the country, and bringing education and understanding of issues around elder abuse, and most particularly financial exploitation, to all of the relevant sectors. The financial sector, the banking industry is
so important.
Very cooperative.
Yeah.
So there's a lot there. And I think you'll be hearing a lot more about that.
Good, because there's so many opportunities and
terrible
for scams, and we see it all the time and hear about
Exactly.
it. And,
Exactly.
I'm so glad that you are at the helm of this exciting department, a new time, very exciting time in the state, and to have you and working with you this year, hopefully in the legislative session. There's a lot, as I mentioned, to work on. Pet projects of mine are, transportation. We hear it all the time.
All the
and
time.
Housing.
Housing.
And people say, well, gosh,
Yes.
Simsbury has senior housing, but we don't have affordable housing. And I want to
Correct.
make sure that, all of us can afford to live where we want to live.
And I can tell you that transportation and housing are two of the most frequently mentioned big issues that I hear as I go around the state talking to people, really in both towns and cities. Everybody has concerns there. And wisely, as a legislator, you looked at a better coordination to try to bring coordination among programs across our agencies in the area, in housing most particularly. Transportation, the governor, of course, has been very strong on his transportation initiative, and that can only be helpful. It's a big problem.
Well, count on my support, and I want to
Thank you.
thank you for your service. Thank you for being on the show. I hope you come back, and we'll be seeing lots of each other before you know it, with the legislature starting in February. And this is Commissioner Betsy Ritter. This is Office Hours with State Representative John Hampton. Thank you for being with us, and we'll see you again next time. Bye-bye. Thank you.